Mr. President, the 115th Congress convened just last week. I'd hoped that with all the turmoil in the country, we'd begin the year with a renewed sense of cooperation. I'm afraid my friends in the Republican Party have chosen a different path. The very first thing we see on the agenda is a sham budget. In fact, when you ask why would you have a sham budget, fake budget, unrealistic budget, well, we find out the only purpose is to set up a process to repeal the Affordable Care Act with a simple majority vote. Why? Because they know the American people would never countenance a repeal and allow a repeal to pass otherwise. So instead of working to finalize appropriation bills for this year, we're already 3 months into it, or to invest in our nation's critical infrastructure, or to really bolster our nation's cybersecurity when we see countries like Russia and other places attacking our cyber systems, or even to improve the Affordable Care Act so we can ensure more people can receive affordable coverage. I'm afraid Republicans are recklessly rushing forward to fulfill an ill-considered campaign promise. They're pushing American families over the cliff with a vague promise that, yeah, we'll repeal it, but don't worry, eventually we're going to come up with a plan to replace it. Jump first, plan later. That's not a very responsible formula for your health, for sound decisions, or all the more so in the health insurance of tens of millions of Americans, tens of millions of American families all over the country, Republicans, Democrats, Independents alike. Their health insurance is at stake. The Majority Leader and others have said a repeal of the Affordable Care Act is only the first step. They say that a full repeal is necessary to pave the way for replacement. Let's leave Obamacare in the past, they say. Well, when you strip away the rhetoric and they get rid of it, there's only one alternative they offer the American people if they repeal, and that is don't get sick. Because if you get sick, you are in trouble. The American people have the right to know what a vote to repeal the Affordable Care Act really means. A repeal of the law would not just take away the rights and care of millions of patients and their families. It would eliminate insurance coverage for millions more, especially the aging, the elderly, or to men and women with pre-existing condition, or the most vulnerable children. Repeal of the Affordable Care Act would turn back the clock to a time, a bad time in this country, once again, where women would have to pay more for health insurance than men, where insurance companies could simply rescind a health insurance policy because someone gets sick. You buy an insurance policy so you're covered in case you get sick, but the insurance companies could say, oh, you're sick, sorry, no more insurance. And coverage could forever be denied to somebody born with a disease or ailment, and that includes children. Now in Vermont, my state, the Affordable Care Act has reduced the number of Vermonters without insurance by 53%. Tens of thousands have gained coverage under the expansion of Medicaid. And because the Affordable Care Act closed the prescription drug donut hole, more than 10,000 Vermont seniors saved $12 million on drugs in 2015 alone. That's in the second smallest state in the union. Can you imagine what it's like in larger states? I've heard stories from many Vermonters how vital the law is to them and their family. I've heard from family doctors, like one in the southwest corner of our state in Bennington, who remembers when his patients couldn't afford treatment because they had lifetime or annual limits on health care coverage, something very common. Or a woman from Westminster, Vermont, whose family had hard times. She moved from job to job. She couldn't afford to keep continuous health coverage. But because of the Affordable Care Act, she could keep continuous health coverage. Now we're talking about throwing her off. Other young Vermonters are able to pursue careers in public service or the arts because they can stay on their parents' health insurance until age 26. Countless others have underscored that because of previous health issues, because they had diabetes or cancer, health coverage would otherwise be unaffordable. It'd be a vicious circle. They'd have a disease, but they couldn't afford to do anything about it, and they get greater in debt. But now, even though they had a previous condition, they have the guarantees and subsidies provided by the Affordable Care Act, and so they can have health coverage instead of health coverage being unaffordable. Opponents of the Affordable Care Act have gone to new lengths to repeat and prolong this political battle. And that's all this is. They've had 6 years to propose a better alternative. We've yet to have one presented in either body. Instead, congressional Republicans and the president-elect have decided to put the cart before the horse. They want to dismantle our health care system. They don't want to figure out how to fix it. Let's just get rid of it. And then, oh, by the way, somebody's going to come up with a bright idea with something better. Well, the American people rightly expect us to work together to make progress on so many challenges we face today. Instead, we're engaged in dangerous political gamesmanship that won't affect members of the Congress, but it's going to affect millions of the families we represent throughout this country because they won't have health insurance and their children won't have health insurance. And just think what this is eventually going to cost Americans. A lot more than we pay now. I'm not going to support a return to less protection, less coverage, less fairness, and higher costs because that's what repeal means. The Affordable Care Act extended health insurance to millions of families, not only in Vermont, but across the country. Those who represent the American people in Congress should stand ready to get to work for their constituents, not to make their constituents sick, but to give them a program that works. I'm not going to support an effort to reverse the many reforms and achievements we made through the Affordable Care Act. Instead, cobble back together a broken system that for too long burdened most American households with health coverage uncertainty and crippling costs. I'm not going to go and tell Vermonters, too bad you had cancer. Tough. We just fixed it so you can't have insurance. Too bad you have diabetes. We just fixed it. You can't get insurance. Too bad your child was born with a physical defect. Too bad. We just fixed it. You can't get insurance. Or the person who's just lost a job. They had insurance, you say, too bad, you're without insurance. Better pray you don't get sick, because if you do, you've lost a lot more than your job. No, Mr. President, I can't look Vermonters in the eye and say that's what I supported.